Do I wish cataract surgery had a 100% satisfaction rate? Absolutely. But is that the reality? Unfortunately, no. Sometimes we eye surgeons have patients who are unsatisfied with their cataract surgery and may regret their decision to have it done. So in this video, I'm going to go through the top 5 reasons why patients regret cataract surgery and what you and your ophthalmologist can do to prevent you from having these regrets. By the way, I'm Dr. William. I'm a board-certified ophthalmologist, and I make videos to help you see better, look better, and feel better too. Okay, the first reason why patients may regret their cataract surgery is because their quality of vision didn't meet their expectations. Now, there are a few different reasons why a patient's vision didn't meet their expectations, and I'm first going to break down the reasons by lens type. Let's first talk about multifocal or extended depth of focus lenses. The benefit of these lenses is that they provide a range of focus after cataract surgery. The basic monofocal lens that's covered by insurance has one focus distance. So, for example, if you have your vision set to distance vision after cataract surgery, then for anything closer up, such as the dashboard in your car, your computer, cooking, looking at your cell phone, or reading, you'll need reading glasses to see more clearly. The benefit of multifocal or trifocal lenses, like the Odyssey or Panoptix lenses, is that they provide a range of focus, helping you see distance, intermediate, and near objects. How these lenses basically work is that they split the amount of light going into your eye into different focus points to give you a greater range of vision. But because that light is getting split into different focus points, there are some trade-offs to get that range of vision. For example, you may notice some decreased contrast, or basically, patients mention that especially in darker settings, things are just a little bit fuzzier and it's harder to notice the details in your visual world. The other thing to be aware of with these lenses is that because of their design, you'll notice that they have a bunch of concentric rings in the lens, as opposed to a monofocal lens which doesn't have those rings. With these multifocal or trifocal lenses, when you look at lights, particularly at night, you'll notice rings or starbursts around the lights. And one last point about these lenses is that there may still be times, not too often, but sometimes, particularly when it's a little dark or you're trying to look at something very close or very small, where you might need a pair of reading glasses to magnify your vision a bit. So if patients aren't aware of these trade-offs before surgery, or maybe they're promised perfect vision at all distances without ever having to wear reading glasses, sometimes patient expectations for their vision after surgery aren't met. Realistically, these lenses are excellent, but they're not perfect. The vast majority of patients with these lenses report that they're very satisfied, but the truth is that they have trade-offs, such as decreased contrast sensitivity, nighttime rings, and starbursts. And even though our lens technology is very good, there is no artificial lens implant that exists that will allow us to turn back the clock and give us that crisp, perfect vision at all distances like we may have had when we were younger. Okay, now let's talk about monofocal lenses. There are also patients who decide to go with a basic monofocal lens and are dissatisfied with their vision after surgery as well. Like we mentioned before, these monofocal lenses have mono or one focus point. So if we set your vision to distance vision, then distance objects will be more clear, but anything closer than about 2 or 3 feet, or about 1 meter away, will be out of focus and blurry. Patients who have had myopia or nearsightedness their entire lives are used to having clear near vision and using glasses only to see clearly for distance. But if they get monofocal lenses set for distance vision, then they're going to lose all of that near vision after surgery. These patients can be disappointed with their vision after surgery, even if they're technically reading 20/20 on the distance vision test, because now they need to reach for reading glasses anytime they want to look at their phone, or the dashboard becomes blurry while driving, or things are a little blurry while they're trying to cook. For this reason, it's very important to discuss with your surgeon prior to surgery exactly what the plan will be for your focus point after surgery and when you'll need to wear glasses. Another useful tip is to take a few minutes to think about what you use your vision for on a daily basis. Everyone has a different routine. Are you driving a lot? For driving, you're going to want clear distance vision so you can see oncoming traffic and street signs. Or do you spend more time reading and watching videos? If so, What kind of monitor are you using to read or watch videos? Is it the TV across the room? That uses distance vision. Or maybe it's a computer screen 2 to 3 feet away, which would be considered intermediate vision. Or is it on a phone that you're holding about a foot away from your face? In that case, we'd consider it near vision. Do you sew, knit, cook, hike outdoors, garden, or play sports? When you think about these different activities that you're doing throughout the day, you have to prioritize what type of vision is most important to you. Is it near, intermediate, or distance? Again, with monofocal lenses, we're forced to pick a single focus point. So we want to decide together what type of vision is most important for you and when you'd be willing to wear glasses. If you're already thinking about your preference before your surgical consultation, it gives you more time to consider your options and come up with a decision that will satisfy you the most. Another regret patients sometimes share with me after choosing a monofocal lens is that they wish they had chosen a toric lens instead. So what's a toric lens? Toric lenses are special lenses we can implant during cataract surgery to address a patient's astigmatism. So what is astigmatism? Astigmatism occurs when the front of a patient's eye, the cornea, is not shaped regularly. Normally, the shape of our cornea is round, like a ball, but in some patients, their corneas are shaped more like an oval, kind of like an egg. When the surface of the cornea is not nicely and symmetrically shaped, this astigmatism causes incoming light to not be focused properly, resulting in blurry vision. People with astigmatism need to wear glasses with an astigmatism prescription to help sharpen their vision. So if a patient has astigmatism and decides to get the basic monofocal lens with cataract surgery, they're still going to have that astigmatism even after the surgery. That means their vision at all distances, near, intermediate, and distance, will still be blurry without glasses. We have special lenses called toric lenses that we can implant during cataract surgery. These lenses already have the astigmatism correction built into the intraocular lens. So for patients with astigmatism, they'll be able to see more clearly after surgery without glasses. I've had several patients with astigmatism come to see me, and for whatever reason, maybe they weren't offered the toric lens, or maybe they didn't initially see the value of it, they didn't have a toric lens placed in their first eye. Then, after seeing the difference, they ended up choosing the toric lens for their second eye. And a common reply I hear from them after surgery is, "Man, I wish I had gotten the toric lens for my first eye too." That's because there's a significant improvement in the clarity of their vision without glasses in the second eye that received the toric lens. Now, not everyone has astigmatism, so not everyone needs a toric lens. But if your ophthalmologist mentions that you do have significant astigmatism and that your vision may benefit from the placement of a toric lens, it's worth seriously considering the option. Of course, if you're perfectly comfortable wearing glasses all the time, that's a completely reasonable choice too. But in my experience, patients with astigmatism are generally very satisfied with their decision to get a toric lens. Okay, so we've talked a lot about the importance of choosing the right lens and understanding what kind of vision to expect with the different lens options, whether you choose a monofocal, toric, or multifocal lens. Now let's talk about another important consideration in cataract surgery that can cause some patients to be dissatisfied after surgery, and that's the focus point. We already discussed how choosing the correct focus point for your lens during cataract surgery is an important decision that greatly affects your happiness and satisfaction after surgery. With basic monofocal and toric monofocal lenses, we have to decide what the focus point of your vision will be. For example, if you want distance objects to be clear and you're okay with wearing reading and computer glasses, we'd aim to leave you with very little to no refractive error. In other words, little or no glasses prescription. If you spend a lot of time reading or using your phone, don't drive very much, and you tell me that you want your near vision to be in focus instead, then I may intentionally leave you with about a minus 2.00 diopter prescription to keep those near objects clear. Then, whenever you need to see things far away, you can simply put on a pair of -2.00 glasses. One more important consideration when choosing your focus point after surgery is whether you're only having surgery on one eye for the foreseeable future or whether you're planning to have both eyes done. If you currently have a glasses prescription, say +2, +4, or -6, we need to carefully consider what prescription we'll leave you with after cataract surgery. Making the wrong decision can cause patients to become dissatisfied and even regret having the surgery. It might seem simple, right? If we have the opportunity to eliminate your prescription with cataract surgery, why don't we just do that? For example, if you have a -4.00 prescription in both eyes, and we decide to leave you with no prescription after cataract surgery, you'll now have one eye with no prescription and the other eye still at -4.00. When there's such a large difference in prescription between the two eyes, a condition we call anisometropia, it can lead to problems with depth perception and cause symptoms such as nausea, double vision, headaches, and eye strain. Generally, patients can tolerate a prescription difference of about 2.00 diopters. For example, one eye at -4.00 and the other at -2.00 without experiencing major problems. So, if we're planning to make a significant change to your prescription during cataract surgery, we may want to schedule surgery on the second eye soon afterward to avoid the problems associated with anisometropia. That's why it's very helpful to discuss with your surgeon not only the plan for the eye receiving surgery, but also the long-term plan for your other eye. Okay, we've taken a deep dive into some of the most common vision-related reasons why someone may be dissatisfied with cataract surgery. Now let's talk about another common reason patients may regret having cataract surgery, and that's dry eye. It's very common for dry eye symptoms to temporarily worsen after cataract surgery. The good news is that in the vast majority of cases, this is only temporary. These symptoms usually improve over the course of a few months after surgery. However, during that time, patients may experience eye irritation, a foreign body sensation, or a sandy, gritty feeling in the operated eye. For example, a study published in 2002 found that 37.4% of patients who underwent cataract surgery and had no previous history of dry eye went on to develop dry eye symptoms afterward. Again, the majority of these cases improved within several months with treatment using artificial tears, warm compresses, or prescription eye drops. For patients who already have a history of dry eye, it's very likely that their symptoms will at least temporarily worsen after surgery. That's why it's important for us ophthalmologists to optimize the health and moisture of the eye and treat dry eye as much as possible before surgery in order to reduce the severity of dry eye symptoms afterward. So we've talked about different lens choices, focus points, and dry eye. Another common reason why patients may regret cataract surgery is that they have other eye conditions that continue to limit their vision even after the cataract has been removed. Let me explain that a little more fully. When I evaluate patients for cataract surgery, I often find that they also have other eye conditions. Conditions like glaucoma, macular degeneration, retinal bleeding, corneal scars, and other reasons why they may have poor vision. I always make sure to share these findings with patients before surgery to let them know we can perform your cataract surgery to help improve the clarity of your vision, but we also need to remember that you have other eye conditions. It could be glaucoma, macular degeneration, or something else. Unfortunately, cataract surgery will not treat those other eye conditions. So yes, we expect your vision to improve after cataract surgery, but because you'll still have glaucoma, macular degeneration, or whatever other eye condition you may have, those problems can continue to affect your vision even after the surgery. I understand that this can be disappointing and frustrating because patients genuinely want to see better, and they naturally hope that cataract surgery will solve all of their vision problems. Unfortunately, for conditions such as advanced glaucoma or macular degeneration, we currently do not have treatments that can reverse the vision loss caused by those diseases. That's why it's so important for us ophthalmologists to perform a comprehensive eye examination before cataract surgery, checking carefully for any additional eye conditions and helping patients develop realistic expectations about the results of surgery. Okay, another eye complaint that can appear after cataract surgery is floaters. One of the most common questions I receive before surgery is, will my floaters disappear after cataract surgery? Unfortunately, the answer is no. Floaters do not go away after cataract surgery. During cataract surgery, we're operating on the natural lens inside the eye. Floaters, however, are caused by tiny clumps inside the vitreous gel, which is located farther back inside the eye. Since cataract surgery does not involve operating inside the vitreous gel, we have no intention of treating those floaters during the procedure. In fact, it's actually quite common for patients to notice their floaters more clearly after cataract surgery, or even feel as though they have more floaters than before. Fortunately, in most cases, these floaters become much less noticeable over the following 3 to 6 months. Nevertheless, seeing floaters after cataract surgery is something patients should understand before deciding to have the procedure. So we've discussed some of the most common reasons why patients may be disappointed with or even regret their cataract surgery. Having cataract surgery is a major decision. For most people, it's a surgery they'll undergo only once in each eye during their lifetime, and the outcome will affect how they see for the rest of their lives. That's why I hope you and your ophthalmologist take the time to carefully consider all of your options and choose the one that will provide you with the greatest benefit and long-term satisfaction. So, to summarize, we talked about how important it is to choose the lens that best matches your visual lifestyle, and to understand the advantages and trade-offs of each lens option. For example, multifocal lenses provide a broader range of vision, but may reduce contrast sensitivity and cause rings or halos around lights. Monofocal lenses, on the other hand, provide a much narrower range of focus, meaning you'll likely need an extra pair of glasses for certain activities and different viewing distances. We also discussed how important it is to choose the most appropriate focus point based on your daily lifestyle. You should think carefully about whether you want to prioritize distance vision, intermediate vision, or near vision. We also talked about the possibility of developing dry eye after cataract surgery and how important it is to treat dry eye before surgery to reduce the chances of experiencing gritty, irritated, or painful eyes afterward. We also emphasized the importance of receiving a comprehensive eye examination during your cataract surgery evaluation so your doctor can identify any other eye diseases that could continue limiting your vision even after the cataract has been removed. And finally, remember that cataract surgery does not eliminate floaters, and in fact, you may notice them more clearly or even notice additional floaters after surgery. I hope that by reviewing some of the most common reasons patients may be disappointed after cataract surgery, I can help you avoid these common pitfalls so you can be as happy and satisfied as possible with your vision after surgery. And please remember, even though I spent most of this video discussing situations where things can go wrong, the vast majority of patients who undergo cataract surgery are absolutely thrilled with their results. In fact, one of the most common things patients tell me after surgery is, "I only wish I had done the surgery sooner." If you found this information helpful, don't forget to subscribe to the channel for future updates. If you live in the Los Angeles, Orange County, or Inland Empire area and would like to be evaluated for cataracts, feel free to visit our website or call our office today to schedule an appointment. And by the way, if you've made it this far into the video, you're probably interested in learning even more about cataract surgery. You can watch my other video to learn everything you need to know before having cataract surgery. I'm Dr. William. See you next time.